we just want to have a kind of report out from groups about what their thoughts are, what kind of themes came up about each of the cases. So the first case was of the learner, the resident or trainee, who had a patient who made some comments that were, escalating, then had some physical contact with her as well. At the end, saying what time to get off work, and then she reported this to her attending physician, who laughed at it. So, wondering what themes came up in your groups about this case. Yeah.
I think somebody brought up that.
Use the mic. Use the mic.
Oh, sure.
We're recording.
Someone brought up basically that this is just like treated same as violence, is that the patient needs to know this isn't tolerated. The person needs to be acknowledged that I'm sorry this happened to you, this shouldn't happen. And we go through the same algorithm of, the patients won't listen to a warning, then if they're stable, they're gone. If they are still not listening to warnings and they're not stable, or they're the underlying disease that we need to deal with first, then, we're down the pathway of sedation and, things can go badly. But I think the main important thing that I took out is that we can't, we laugh it off because it's like, oh, there's this, old kind of crazy guy hitting on a young person, where it's like, clearly this is, not a wanted thing and it's not okay. But I think it is easy to kind of laugh that off, but it shouldn't, because I think women are probably harassed in our emergency department on a nearly daily basis, and I don't think that that's okay to just laugh it off.
Thank you for that. Thank you. Other thoughts from other groups on this case? Yeah. My favorite group. Sorry.
We discussed how, if you're the attending for the learner, how to know what to do next with that, the learner's concern. As Kat was talking about with the mandatory reporting requirements, it'd be difficult because, in some circumstances, just patients in the ER making a comment that makes a learner feel uncomfortable. I mean, it happens a lot to learners, probably predominantly more female learners than male learners, but I'm sure it happens to both. And you don't want to blow it out of proportion and make the learner feel uncomfortable that they told you if they're coming to you is only to get an affirmation and support, if they didn't want it to turn into, quote unquote, a big thing. But you also have the mandatory reporting requirements, so we sort of wanted more background on what we needed to do as the attending in that scenario, especially because this probably happens quite regularly in the ER.
Mm-hmm. Yeah, so this is a scenario in which you kind of have a double hit. So she's not only been harassed by her patient, she's now been dismissed by her attending. So the question is the attending's behavior bordering on harassment? So it's a double-edged sword there. And whether or not it's a culture thing in that environment, and that's why he behaved in the way he did, we're not sure. But it's just something to get your wheels turning, get you thinking about it. I think the other thing that you can think about is, as a co-faculty, if you had overheard this interaction, one of the things that we talked about in our group was there are things that you can do there for the learner to support the learner, even as a person who wasn't directly involved with the interaction. But there are also things that you can do to help your partner, your colleague, grow. And so the first thing is, addressing the person who's been harassed, acknowledging her experience, and telling her that you just saw that interaction between her and the attending, and say, when I watched that, when I overheard that, that made me uncomfortable. So I'm curious, was that uncomfortable for you? So just noticing, sharing your observations with her, and then, whether or not she wants to share her thoughts, that's totally fine. But then also taking your colleague down the hall. Say, let's take a walk. Let's go get some coffee. You say, so I heard that interaction between you and the resident about that patient that was giving her a hard time. And I have to say, from my observation, if I had been her and I had just tried to explain something to you and you responded the way you did, you laughed. I'm curious, what was it about that made you laugh? Can you help me understand where you were coming from? Because most of the time, again, if you assume best intent, if you assume folks are actually not trying to dismiss people's concerns, it's possible that he's having a bad day and he doesn't have bandwidth to respond in an empathic way to everybody. And it's not until you call him out and you point out objectively what you saw that he's like, oh, I was so distracted because I just got off the phone with that cardiologist about that situation that we were dealing with in the cath lab, and I didn't really listen to her. I'm going to go back and I'm going to go fix it, right? So you give him the opportunity to repair any sort of challenge with his relationship with that resident, okay? Or you could get it's not that big of a deal. And then you can further push him as his colleague and say, I actually do think it's a big deal. Because from my perspective, again, if I had brought a concern to you as your peer and you blew me off like this, it would frustrate me. And it would make me feel like you don't actually, respect my bodily autonomy and the fact that a patient was doing something inappropriate. I feel like for me, what I would like to see is I would like to see in that situation that you stand up for the resident, that you go address this with the patient, and you make sure that everybody in the department knows that this kind of behavior is not okay. That's what I would like to see. What do you think?
Thank you, Kat. Thank you so much. I know it's just 3 minutes. We have 2 minutes left before 5 o'clock. Any, just from the other two cases or any of the cases, any best practices that you've kind of come up with? Anything that you're like, wow, I'm going to use that starting tomorrow when these kind of situations come up? Anyone want to share something novel, cool approach to these challenging situations?
I think one of the really big ones that came up for us was that it's important not only to validate what happened, but also to overcome fear of reporting something and make sure that the person who is the offender is aware, because we only got to one scenario and it was not one of the ones that we talked about. But in that scenario, there were multiple offenses that had historically been observed, and so we felt like it was very important to not just be a bystander and to say something and or report it to the appropriate people so that we make sure that the person is aware that whatever behavior they're doing was not okay.
Mm-hmm. Thank you. All right, so we want to get y'all out of here in case you want to go do something else other than talk about sexual harassment. And so ultimately this comes down to educating ourselves, right? And being able to disseminate important information to our learners, to our peers, to our institutions, and making sure that things are set in such a way that it's easy to access these resources, it's easy to know what to do. And so when you think about these situations which happen for the trainee, which happen for a colleague, or which happen in a supervisory situation, also think about yourself. What if this happened to you in your institution? What would you do? So I think it's also important, we've already hinted at this, but we want to make sure that we're using inclusive language when we talk about sexual harassment. And so physicians need to take this process built upon safety and encourage those in medicine to be brave and to speak out when they are witness to someone else who is being harassed or disrespected. Every physician, regardless of gender identity or gender expression, should feel empowered and encouraged to speak up without fear if they ever experience or observe a behavior that betrays the values central to that person's identity. Every physician should be brave enough to say, this behavior makes me feel uncomfortable, I feel disrespected, to anyone who's inappropriate or disrespectful. So our charge to you is to get to know what the resources are in your institution. Go home, take a look at the website, figure out what the deal is with Title IX, and also share this with your colleagues that didn't come today. Help them to understand what this process is. And if the process is not crystal clear and transparent, challenge your leadership to fix it. If you would like to hang around, we were happy to answer your questions. If you want to take off, that's also totally fine. Here are some resources. These are our favorite articles that we kind of collated together. And at the very bottom of this Google document, you'll also find a link to something that will provide you with some resources should this ever happen to you, some resources for counseling and therapy and whatnot.
And just a reminder, the evaluations, if you just, take 30 seconds to fill them out and leave them on your seat is fine. Actually, we'll click them after if that's, or leave them on the chair by the door. Sorry, Kat.
No, that's no worries. So if you have that evaluation, we'd love that. And if you want to hang around for the debrief, we're ready to roll into that as well.
Thank you for coming. Thank you so much.